Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Jessi Grote. Today's guest is RN Britta Tracy from Madison County Healthcare System in Winterset, Iowa. Britta completed the IONRP in January 2023.
Hello and welcome. This is Jessi with the IONRP, and we have with us today Britta. So Britta, if you just want to share with us how long you've been an RN and then what type of facility or unit that you work on.
Yeah, awesome. My name's Britta Tracy. I'm currently working in outpatient nursing with a pediatrician, so specializing in pediatrics. I've been a registered nurse for about 2 years, came onto the job fresh out of school. I also have about a year of med-surg experience as an LPN, and then spent some time prior to that working in a nursing home.
Awesome. I love that. So did you start the program right away when you first started in the clinic?
So I had been in the clinic for probably about 8 or 9 months when they asked me to start doing the program.
So how do you apply the concepts covered in the program to the area that you work in?
So there's definitely a wide array of concepts that get covered in the nurse residency program. Some of the big takeaways that I got were definitely communication and teamwork. You know, working in the clinic, I'm working one-on-one with a provider. So communication is really key. Communication between patients, communication about just messaging about when patients call and what their concerns are. And then another really big one is communication with the patients themselves. And in the clinic, working in pediatrics, as you can imagine, we're communicating not only with the patients, but then with the patient's parents and family members and just their support services and support groups. And so there's just a lot of communication that's happening. The other thing that I got a lot out of was the time management portion. So delegation, we are seeing patients every 15 to 30 minutes, and I also have to do immunizations in there. I also have to do my faxing, my paperwork, charting, phone calls. So it gets to be kind of busy. And at first it was definitely overwhelming because you're like, okay, I'm going to do this. And then you're kind of jumping around like a little jumping bean, trying to figure out, what do I need to do next? So the delegation and the time management was also something that was key, and just prioritizing, what do I need to get done right now? What's most important? And then just kind of going from there. If something pops up and you're like, this needs to be done now, it just jumps to the top of that list. And one of the things that I struggled with was you can't get everything done in one day sometimes. Sometimes you have to set this aside and say, okay, this paperwork can wait until tomorrow morning. And then again, just communication with the patient. Hey, I'm working on this. This will be done by this date. And so just all of those concepts together really applied to me, especially in the clinic and in nursing in general. So I think that was something that was really helpful for me.
That's wonderful. Thanks for sharing that. I love how you kind of flip that to that clinic perspective and just how those things have benefited you. That's great. So what was the focus of your professional experience?
So I did a change project, and I was focused on providing educational resources to the other nurses, CMAs, LPNs, RNs, even providers within the clinic to improve the pediatric immunization process and improve their education on it. So I put together just a binder that had immunization schedules 0 to 18, what schedule we used within the clinic that worked, what immunizations we use, how to administer them, IM administration, subcutaneous administration, needle gauge size, length, muscle places to administer, so many different things, catch-up schedules, contraindications, and it was something that I wish I would have had starting out, especially starting as a new RN in the clinic and with pediatrics, so going right into a specialty and doing all those immunizations. I had done one IM injection probably in nursing school, so it was definitely something different from doing one IM injection and doing 20, 30 a day. So it was definitely a learning curve for me, and it was a resource that I wish I would have had. As soon as I started, I had people coming up to me asking, well, can you look at this kiddo with me? Like, what are they due for? And I would be like, I need to look a little bit. And the CDC is a great resource, but definitely can be very confusing to just look at it if you've never done it before. So creating the binder, creating easy reading material, creating education on why we give the immunizations. So that way, if a parent's like, well, why are we doing this? You can kind of help educate. And it's something that I've seen used multiple times. So I think it's a great resource. Even seasoned nurses are going to using it and just keeping updated on it. So it's something that I'll keep updated yearly. As new stuff comes out, we'll update the binder. And I think it's just a great resource for current clinic employees, but also ones that we're onboarding. So, hey, look at this, look through this. This is a resource you have available to you because although we're the main pediatrician, we have family practice providers. So a lot of other nurses do see pediatric patients. So it's something that was just made available. And I'm so glad it's there now. I wish I would have had it, but like I said, it was a learning curve and I've learned a lot of what I've done on the job. So it's been awesome.
Well, that's wonderful. And it's such a good feeling too when experienced and new nurses alike are benefiting from it. I think that's just very rewarding. And you'd also mentioned that from this professional experience and the project that you worked on, that you're now getting asked to do some other projects and things at the facility. So that is definitely how that tends to go, but also kind of a feel-good thing, right? When people are able to see the benefit of your work and you're able to continue to help to improve your practice, because that's what we're always wanting to do. So I love that. So what did you find to be the most beneficial aspect of the program? I know you talked about the concepts and your professional experience, but kind of overall, was there anything that you found to be just like kind of the icing on top?
So I have to say, and it sounds cheesy, I don't think there was one specific thing about the program that was like, oh yeah, that's way better than this part of it. I think the program, how it's set up, the components of it, the projects, the learning material, the resiliency training, I think it all goes hand in hand just to feed every part of you as a nurse. I think that the educational component feeds your mind. It gives you the knowledge and it's a great refresher. The professional experience project definitely fed my motivation. I'm motivated now. I want to grow into a leader. I want to keep educating other nurses. I want to grow my own knowledge and keep learning. I think that's just the name of the game. As nursing, we got to continue to evolve and we got to continue to do what's best. And then I would say the resiliency definitely fed my soul. I was kind of starting the program at a point where I had kind of gotten through some of the darker times. I mean, there's definitely difficult days, but I think it's a great resource. Like, it's something that I wish I would have almost had sooner. So when the opportunity was presented to me, I was like, definitely, because this is needed. And the resiliency training I still use today. Sometimes I got to stop. I got to take those deep breaths and I got to be present in the moment. And even yesterday, I had a patient ask me, what's your why? Why are you doing this? And I was like, oh, right. I'm doing this for a reason. I have a purpose behind my actions. I have a purpose behind my goals. I care about my patients and I just have a love for the job. So I think it's something that it works all together. It creates the intelligent, compassionate nurse that we all want to be. And it just reinforces that and gives you the opportunity. And I think it's great. The resiliency training, definitely. I think we have to take care of ourselves. Otherwise, it is difficult to take care of other people. I think you get burnout some days. And like I said, you're going to have tough days, but I think it's just kind of what you do with it. You learn from it and you grow. And I think we saw, our other residents in the class, we would pull up the graph and we'd be like, where are we at? And we would see them, they'd be dipping and then we'd be coming back up and they'd be using their resources and they'd be like, well, this worked and this was helpful. And there's just so many takeaways that I love about this program that make it what it is. It's just resiliency training, education, just all of it. I would have to say that all of it works together to create an outcome for your health, your mental health, your education, and just helps shape who you are as a nurse. And I think it's so important in that first year of nursing because it's tough. It's definitely something that's tough.
I love that. Thanks so much, Britta. Gosh, that just warmed my heart completely. Well, is there anything else that you'd like to share with current or future residents?
Yeah, definitely. I would just say, trust your gut, take care of yourself. Always remember why you became a nurse. Like I said, when my patient asked me, what's your why? I'm like, it kind of brings you back. You're like, okay, yep, this is why I started. This is the motivation behind it, just a love to serve people. I think there's days that are going to be tough. As I've mentioned, there's tough days, there's tough months. Sometimes you go a month and you're like, what am I doing? Like, am I sure this is where I want to be? But I think that you just got to remind yourself, use the training, use the knowledge, really dive into it, use the journaling. I think that's a great resource as well. Just trust in who you are as a nurse, trust in what you're doing, and trust your gut. Like I said, you don't have to be perfect all the time. You don't have to be the best all the time. I think if you have your heart in the right place and your mind in the right place, and your goal is to serve others and take the best care of your patients as you possibly can, that you can't go wrong.
Awesome. Thank you so much, Britta. You were such a joy to have in the program, and I got to work directly with Britta, which was really exciting. And I'm just so excited to see your growth and wishing you all the best as you continue with school and just all your goals and just everything. Thank you again for coming on today, and we'll chat with you soon.
Thank you.